David Rees. I'm a paediatric haematologist at King's College Hospital, and I see children with sickle cell disease.
And I break the walls that you've been building. Whenever I get close, you begin to pull away, and I don't hear from you until you're ready.
The commonest symptom adults and children with sickle cell disease get is acute pain. They get sudden onset pain, which can be anywhere. Often it's in the arms or the legs or the back and the head, and it's triggered off by the blood vessels being blocked by the abnormal red cells that are caused by the sickle cell disease. And so people are well a lot of the time, but then are struck down by sudden, very severe pain that often means they have to go to hospital for very strong painkillers. And the pain lasts typically for 2 or 3 days and then gets better. And often there's no permanent damage done, but it's obviously a very unpleasant symptom. It disrupts people's lives, and when you get the pain it's very, very bad. It's almost like breaking your leg or breaking your arm or something like that. It's that sort of intensity. But it's a very variable disease, and obviously there are many long-term effects. The aim of looking after children and adults is that people should have a happy and normal life, but sometimes people are unlucky, and the risk of dying young is certainly higher. It's an inherited condition. Usually both parents are carriers, and then when they have a child together, there's a 1 in 4 chance that that baby could inherit sickle cell disease.
In me, you can't confide. What am I to do? I'm on you like a tattoo. I'm lying here thinking.
A lot of research is geared towards trying to identify genetic differences between people, and if we could do that, then we could test babies at birth, for example, and predict which babies were going to have lots of problems and should have aggressive treatment, and which babies were going to have very few problems and could be managed in a different way. We're doing blood tests to try and predict again who's going to get particular complications, so to try and look for differences in the proteins in the blood that might explain why some children are very ill and others are quite healthy. We're very keen to try and take part in any trials or studies where new drugs are tested and developed. In terms of treatment, it's still very primitive. There are very few effective options available. At the moment, the only way children can be cured and adults can be cured is by having a bone marrow transplant, which is currently quite a dangerous and difficult thing to do. One problem with with doing research in sickle is that people aren't aware of the condition as much as they should be. So whereas people see cancer and heart disease as a big problem, there's very little funding for sickle cell disease, because although it's common and a very important disease, there's not been a great awareness of it. So in terms of funding research, it's very difficult to find money to do the research that needs doing, and any money raised by events like this is vital. It makes a huge difference.
People say I gotta do what I gotta do, but I'm still thinking about all these questions. Now I told you that I love you, and now I told you that I need you. Stay away, you're straight. I don't know, but I know that I don't wanna lose you. And now I told you how I cry for you. And now I told you that I die for you. Stay away, you're straight. I don't know, but I'm glad that you know how I feel.